Right, so...
We have to do this.
Action.
Welcome, Faisal.
That's it.
Right, so you're an expert GP. You've been a GP for like 100 years. Do you want to give us a little outline of your, not like your whole LinkedIn profile and stuff, just a little...
It's going to show how sad my life is.
A potted history of all the cool things you've done over the years.
Yeah, sure. So I qualified in 2007. At the time, I wanted to be a surgeon. So I trained as a surgeon for a couple of years. Then I decided I wanted to be a general practitioner. So I became a general practitioner. Following this, I realized that I still had a lot of musculoskeletal knowledge, which was something I could use to help my patients. So I became a general practitioner with a specialist interest in musculoskeletal medicine. And over time, that sort of morphed into a sports and exercise medicine role that I now am part of between here, Oxford and Surrey.
Wow. So that's really interesting, isn't it? You're always learning and you're always exploring different things that that you enjoy. But what is interesting is that you're doing things that you enjoy the whole time. So is that the advice you would give to people thinking about a career in healthcare, or because there are lots of careers, aren't there?
Absolutely, and it can be confusing and overwhelming, in fact. And my best advice is to find something you like and work with that, and then integrate your other interests, because most people have more than one interest. So integrate your other interest as you go along, starting with one. And don't worry about having not picked your most important interest or your favorite interest. Just start with one and then work your way through.
Yeah.
There's plenty of time to develop and evolve, and you'll get there, and so long as you're happy.
And with the surgery thing, because it is interesting that you built on your career, because the surgery was orthopedic surgery.
That's right, bone and
interested in.
joints.
So you've got the surgical aspect of, muscles and bones, and then you've got general practice, which is like more of a holistic view of the patients with their bones and joints. And now you've got this kind of musculoskeletal specialist expertise. That's not something that many people do. Would you mind sharing what that role would end up being at the end of your training?
Sure. So there are many ways in which a musculoskeletal medicine doctor can help patients. And that manifestation could be applied to, for example, a unique set of patients. So you could work with athletes or sports persons.
People like me.
People like you, yes. Or you could apply it to a certain specific subgroup of patients. So, for example, patients with complex pain, chronic pain, or patients with diabetes, for example, or academy footballers, so young kids who are trying to develop into a career in football or some other sport. So you can apply your skills to a variety of different patients. So it might be, or you could do research. So there's plenty of opportunity to apply your musculoskeletal knowledge. So long, once you know how to apply it onto patients in a holistic sense, and that's where really the skill is, and that's where I think general practice was amazingly helpful. I don't think I would have had some of the skills I have now without general practice.
Yeah.
Because it just teaches you to connect with another human, which is quite
Yeah,
rare.
I think it is something special, actually. The fact that you're a part of patients' lives and they're a part of yours, and you kind of, I suppose the TV version would be the hospitals would be the big blockbusters, where you got the potentially catastrophic big events that can happen in your lives, and general practice is more of a soap opera type of thing where you build on your previous conversations, and I think patients are much a part of your life as you are of theirs, especially those with chronic diseases. But going back to so that's really interesting. So musculoskeletal is for people who have problems with their muscles or joints in some shape or form. People who don't have a particular problem but need to get healthier and have better disease control, like of diabetes. And then the athletes, the people who want to like finely tune their muscles and joints to to have peak physical fitness.
Absolutely. I think these are the three main domains of modern day musculoskeletal and sports and exercise practice as recommended by the Faculty of Sports and Exercise Medicine. And that's sort of musculoskeletal medicine, which is the bone and joint medicine that you talked about. Exercise promotion, which is where we try and get everybody to be more physically active, regardless of health condition or prior background. And then there is team care, which refers to sort of more of the sporting environment. Important to remember that it's not just elite sports, it's also your local martial arts competition or the motocross happening in the wilderness, or the marathons or the running events. So it's all of that physically active sort of sporting activity, all the medicine that comes with that. So, yeah.
Do those three cohorts, do you find that you support them differently, or is there a lot of overlap between those three areas?
So the underlying core clinical skills are actually similar
Right.
for all three of those. But each one of us, sports medicine trainees or consultants, will approach these three domains differently. So I know some colleagues who are very much into exercise promotion, but perhaps not so much into musculoskeletal medicine. And their job roles reflect that.
Oh, I see.
And then there are others who are perhaps a lot more into the elite, sort of the team care element, but perhaps not so much in the exercise prescribing element. It's just how they relate with them. But all of us will do all three of these domains, because to be fair, you can't treat a musculoskeletal condition without some element of exercise promotion.
Yeah.
And a large part of this is actually social activity, which is your team care element.
Yeah.
So if a group of middle-aged ladies decided to go for a walk in the local park, that's a team care event. So you can't do the three, you can't sort of divorce the three, as it were.
And I suspect there's a lot of, some of it is advising on exercises and techniques and things that you can do to sort of improve, but is there a lot of psychological aspects to improving joint and muscle health?
Absolutely. It's a big part. And funny enough, it's a big part of whether you're trying to become the fastest man on earth, or if you're trying to just get regular with going to the gym. And the principles are very similar. It's a case of what resources you have to your disposal and what approach you will adopt. But the overall principles of sports psychology, which, by the way, is now coming out as a specialty interest amongst psychiatrists as well.
Oh, really?
Yes, it's a growing field, actually. And a big part of this is they're trying to consolidate the principles of how we can motivate ourselves, whether it's for the weekend run or whether it's for international rugby or something like that.
Yeah, because there is that behavioural change piece, isn't it? That is really hard. And I have to admit, I kind of struggle with that myself, because, you find 50 excuses why you just, not today, or I'm busy, or I'm late, or it's dark, or it's too bright, it's too wet, too dry.
Cold, too dry.
So, I don't know, for somebody like me, who is a member of a gym but doesn't really go, the whole experience is kind of not particularly pleasant. Goes for occasional walks, maybe. Don't really run. I used to be quite fit in the olden days, but what advice would you give somebody like me who kind of thinks, yeah, fine, I know I should exercise a little bit more, but I kind of don't?
That's a really good question, and I think behavioural change is an evolving field in musculoskeletal and exercise and sports medicine. And we're consolidating so we actually have a course and a training program around this.
Okay.
And without sort of turning this into a consultation.
No, I don't mind.
But, one of my...
It's really important to get the answer.
One of my best advice for you is to write down, not the reasons why you wouldn't want to be active, but write down the reasons you would want to be active. Ask yourself what's important, and ask yourself what change you can do and why. See, knowing you for as many years as I've known you, I think you're the kind of person who are much more likely to be physically active if the activity was a social one, if there was an element of teamwork involved. So if there were friends, colleagues, loved ones going and doing a shared activity, like a sport, for example, you're much more likely to take part in this. And there's plenty of us who are like that.
The problem is actually, this is a really interesting conversation, and it is relevant to your role and what you do, and actually more it's about general practice as well. One of the problems I have with team stuff, I used to play lots of squash, and then I kind of stopped really. I remember it clearly because I was playing with a friend, and I was kind of like, I don't know, I didn't feel like I could get to the ball on time. I couldn't, and I didn't feel like I was giving him a particularly good game, and then you feel like you're letting the other person down.
Slightly embarrassed.
Yeah. Look, I'm not that easily embarrassed, but you do want the other person to have a game. So if they're just like, it's embarrassing for them. So the team sport thing becomes kind of challenging. The same would apply to football or tennis or wherever. So then you think maybe I should exercise by myself or do something by myself. And I know you should do something little and often and do a tiny bit and walk and get off a bus stop earlier or something. But it's the kind of doing it that's the problem. So
I suppose there's one of the skills that we talk about in motivational interviewing and behavior change is sort of efficacy scoring. So if I was to ask you on a scale of 1 to 10, where 10 being the most and 1 being the least, how confident are you that you could do something, make a behavior change? And that could be anything. It doesn't, something that's better than what you're doing now. Next week, what number would you give it?
10.
Yeah?
Yeah.
And why would you give it a 10? Why wouldn't you give it a 9 or a 7?
Because the standards I've got are very low. So that would be, just going for a walk, basically.
Yeah.
So.
Yeah. And what would be the benefits of going for a walk for you?
Feel better. You can think better, I think.
Clarity of mind, yeah.
Lots of good ideas on walk stuff. You get change of scenery. I remember with COVID and all the rest of it, people were cooped up at home, and remember you couldn't even go out. It's kind of like,
Yeah.
Bit of fresh air. I have to say, this time of year is awkward because it's dark.
That was going to be my next question, which is, my next question to you then would be, what would be the drawbacks for going for a walk tomorrow?
The excuses are normally
what are the
come up
prices?
with.
Yeah, what's the price of it?
The excuses are normally come up with. It's late. I haven't got time. I've got other stuff I need to do. I've got this deadline. There's always
something that comes in the way.
The weather. Sometimes.
So a competing priority of some sort. The weather is another issue.
Often you blame the weather or other stuff.
Yeah.
You think that is more important.
Sure. So on a scale of 1 to 10, which is the next question, how important is it for you to be physically active in the next week?
Not like I've gone through a couple of years, a few years without a lot of exercise. So
Sorry?
I haven't exercised regularly for a few years. So importance-wise, is like
What number would you give it then?
It's not something I have to do. You don't. Nobody's keeping a register.
So no, you're not keeping a register. You're just pegging it in your mind psychologically and trying to figure out
5.
A 5. Yes. And why is it a 5? Why not a 3?
Yeah, now you think about it, it is a 3.
Then why is it a 3 and why not a 0 or a 1?
Well, there you go. I think you hit the jackpot there. It's a 0 probably.
It is, isn't it?
Yeah.
Yes, and the problem is you don't see it as important.
Mm.
And if you were to see it as important, there's a chance you might prioritize it in your list of priorities.
Mm.
You're probably thinking, well, I'm not very active, but, I've got time. I can get healthier later on.
Yeah.
Maybe 6 months down the line or in the summer or next year or something like that. And that helps you understand the problem a little bit better in a bit more detail than you had before we started out. And you could continue along this way and you could say, well, okay, let's consider 2 possible futures. Let's say you carried on doing what you're doing now and you're exactly where you were. You and I both know that you just keep procrastinating, you just keep pushing it back because life comes in the way.
Yeah.
What do you think might happen if you never became active or didn't become active for another 5 years?
We'd probably start getting ill, I suppose. And
what do you mean by that?
You kind of at the moment I'm choosing not to be active, whereas I think potentially, in 5 years' time, then I may not be in a position to be active.
Sure. And what might that position look like or feel like?
Well, joints seizing up,
So pain,
muscle weakness, pain,
weakness,
being sad.
being sad.
No, you kind of, because it affects your mental health, doesn't it? Like with COVID.
Yeah, that sense of not being able to do what you wanted to do.
Yeah, because it's funny that you want things that you can't have. So the fact that walks are easily available.
You don't want it now.
You don't think, no, I'm all right. But if you said you're not allowed to go on any walks.
That's true, isn't it? And then suddenly you'd be like, oh dear, I wish I were desperate for a walk. Yeah. So what I'm hearing is, and correct me if I'm wrong, what I'm hearing is that you appreciate a sense of having symptoms, some kind of pain or some kind of illness. And then there's that sense of, I don't know if I want to call it failure, but it's more a sense of losing out on something that you have now. So fear of missing out on something, so that's interesting, isn't it? And do you have something to live for?
Well, funnily enough, and then I found, this is my personal experience, but also with patients as well, is people often not that bothered about themselves, but they do care about their parents or their kids.
Yeah, or close family and loved ones.
Yeah,
absolutely.
So being around for them and stuff is.
Could that be a problem potentially if you were more active?
Yeah, it'd be a good thing. Yeah, I'd say being able to play football and
exactly.
doing fun things.
So if you weren't active for the next however many months or years, is there a chance you could miss out on that as well?
Yeah. So I think that is really, really interesting that, and actually, if you were to go to somebody and give them a bunch of exercises to do,
they might do it.
They might say, yeah, no, whatever. Normally people would say, yes, of course I'll go and do them. Is there anyone who you've met who said, no, I'm not doing that?
Quite a lot.
Really?
I get that all the time.
Okay,
I get that all the time.
Most people just say, yeah, it's fine, and they got no intention of doing it. But supporting people to kind of understand how that fits in with everything else actually is a much better way of doing things, isn't it, to make that change sustainable.
Absolutely. It's about evoking a reason from within. And that's a skill in itself. It's not a sort of a parlor trick or a technique that you can just try on somebody and it'll just automatically suddenly make them work and suddenly make them want to be active again. But it's more about using whatever skills we have as doctors and as human beings, to be able to evoke a reason to be more active and amplify that reason such that it becomes a priority.
And it's up to people to choose that, isn't it? There's not like, you shouldn't be making people feel sad or bad about not wanting to exercise at that point in time or change their behaviour at that point in time.
Absolutely.
It's okay to just carry on as you are, isn't it, presumably?
So not that it is okay to carry on as you are, because if it were okay to carry on as you are, then there would be no need for the consultation.
True.
But what this is about is not being judgmental.
Yes.
Not being paternalistic almost. And not being prescriptive, not telling people what to do, rather getting them to see what's important for them. So I remember explicitly this particular patient who I had spoken to for quite some time. We were talking similar to how I'm talking to you.
Okay.
And these consultations can take you on journeys and on parts of patients' lives which you wouldn't normally explore. And I ended up encouraging him, or we ended up making a plan where he would just repair his kitchen. For somebody who was just not doing any activities, he was not compliant or not taking his medication, not attending his medical condition reviews, so like diabetes, asthma reviews, etc. For somebody who would call the practice and complain about all sorts of problems that they perceive to be sort of trespasses on their life and on their persona, for us to have that agreement and then to make a plan that says, I'm going to be active and I'm going to make my family happy by fixing this kitchen that I've never fixed, which I thought was a significant win. So it doesn't always look that the way we might think it does.
Yeah.
Not everybody ends up going on a run or joining the gym.
Yeah, and I think it is that it's the patient's plan, not your plan.
Absolutely.
So they need to
Evoke
build it and own it.
Yeah.
And it's okay, you're there to help and support them to kind of,
absolutely,
if they get stuck.
And in a way, as clinicians, it's most amazing to watch patients come up with their own ideas.
Yeah.
And then you sort of helping them build it, if you like. But it's their thing, it's their idea, it's their plan. And even if they don't, they're much more likely to follow through. But even if they didn't, they still have ownership of it.
Yeah.
And that's just amazing to watch and be part of.
So thank you so much, Faisal, for that. It was really insightful. Insight to a specialty that actually I wasn't really that aware of, actually. What are the top 3 things that you would say to people thinking about working in the NHS as clinicians?
I think the most important thing I would say is do what you love. The second thing I would say is start with something that interests you. And the third thing I would say is don't be afraid to explore and integrate your other interests as you go along.
Really good tips, actually. And for people who don't want to be clinicians, but they're thinking about working in the NHS, like, there's a whole bunch of jobs, aren't there, non-clinical jobs. Can you name 3 jobs that people might want to do in the NHS which they may not be aware of?
There are some excellent roles in clinical coding. There are some information data analytics operators who support the service. There are some good old engineers, and biomedical engineering departments are quite well established.
And there's a lot of digital health, isn't there?
So much.
Like lots of really interesting AI and all of that, metaverse and the virtual reality stuff. There's a lot of really interesting, innovative things going on in the NHS.
Absolutely.
And
big
you
data.
Encourage people to get involved.
Yeah, big data is come to town, essentially, and there's lots of jobs involved in that. And I don't actually understand their roles or their title as well as, I do some of the medical ones, but I've met a few of the data analytic operators in some of my courses, and some of the work they're doing is so amazing. It truly is impressive, both for research and for clinical practice. For those people who don't wish to do a clinical job, my advice to you would be that not all the fun is in medicine or is in clinical practice.
But arguably, there's more fun in the non-clinical roles.
I'm biased, so yes. But I think you can find a sense of purpose and usefulness and enjoyment from not doing clinical work.
Perfect. Thank you so much, Faisal, for coming along and sharing your wise insights.